Hey, welcome to Socialism for All. Today's date is July 20, 2021. And in this video, we're going to talk about the probably upcoming Delta wave of the COVID-19 pandemic, particularly the recent actions by the UK and what's also going on in the USA with regard to the Delta variant. If you like this video, please click like and subscribe and consider supporting us on Patreon. There's a link to Patreon in the video description. So, before we get into the articles that I had picked out for this, imagine for a second that it is January 2020 or February 2020 when I started this channel. And I told you that in a month or two, there would be a pandemic. And it would be unlike anything that the West has experienced. And even things like SARS and things like that in Asia, it would be worse than that. It would spread to the whole world. It would close down most of the businesses. A lot of people would get sick. People would die. There would be product shortages. The economy would crash. People would be restricted from engaging in certain kinds of travel, etc. So when we went into 2020, we went into it blind. We didn't know what was coming. So that's the difference between then and now, is that in January 2020, February 2020, in the West at least, if you weren't in China or Italy or, somewhere that got hit early, let's say December 2019, just for whatever, before anybody knew that this pandemic was coming. Everybody was just carrying on about their business. Do you know how much harder it would have been trying to deal? I mean, and people lost their minds as it was in 2020. Oh, I'm not going to wear a mask. I'm not going to stay in. I need to get my hair cut. All that stuff. Now imagine that you had prepared people a year in advance and then told them that that was going to happen. So imagine how much more people would have lost their minds because, they'd have time to organize their thoughts on the subject and everything else. Well, I think that there is another massive wave of coronavirus that's going to hit the world, and possibly it could be as bad as 2020. I don't even want to let myself go there, but I don't know that we really have a choice. So yesterday, July 19th, the UK coronavirus restrictions expired and were not renewed, and they just lifted them across the board. So right now, the UK is back to pre-pandemic measures, as far as I'm aware, pretty much across the board. They are also in the grips of a COVID spike due to the highly contagious and more severe or more virulent Delta strain. That is basically they're back to where they were in January. So all the progress that was made in the last 6 months has been lost. They're back to where they were in January. And the curve is climbing, you can see on the screen, at like an 85-degree angle. It's just shooting up. And you can see the blue line there is the 7-day average of cases. And then the orange or peach color is the absolute cases. You can see it's only 20 points behind the absolute peak, and it's headed for that. Now, at the time of that earlier peak, this was the winter. If you look at, people are sicker in the winter. Part of it's sunlight. Part of it's your system's more stressed because of the exposure to cold, things like that. But more people die in January than in any other month, just naturally. So people are just sicker and weaker in the winter, generally speaking. Also, people are inside and spreading, viruses and things more easily because it's not fresh air. It's not circulating. So we're in the summer. People are outside the most, kind of at their healthiest, getting fresh air and sunlight and all that. And the cases are spiking. This is the worst time to be easing restrictions. The UK is a global travel hub, and what they do is going to have consequences for everybody else. So let's read some articles so that we can get into the details here, because I think that this is, I don't want to say apocalyptic problem, but that's kind of what my mind is coughing up. Who knows? Maybe there will be some big curveball. Maybe, the Delta variant will somehow die out on its own. But absent that, absent some huge curveball, what I see is more bad times ahead, because we're 2 months out from fall. Okay? In 2 months, it's going to be September 20th, and people will start going back inside. And that's when the cases really started to spike last year. And Delta is about 5 or 6 times worse than the original strain of COVID in terms of transmissibility and severity. So it's bad. And we may see a really bad wave. So it looks to me like the governments have given up, basically, by telling people just go back. And who do the governments get their policy from? Wall Street, City of London, big capitalists. Their system needs to stay off lockdown. They need people to be happy spending consumers. That's what they need. This is not science-based policy. This is capital-driven policy, profit-driven policy, nothing else. Wearing a mask costs you nothing. Businesses having to do some social distancing, reorganize your aisles or, checkout lines or whatever, it's not a huge deal. There was no reason to lift restrictions in the US. People should still be wearing masks and distancing. And that's what the World Health Organization says. I just, it's hard for me to communicate the severity. It's like, imagine if, we're in November, December 2020, and there was a way to avoid the pandemic. Well, we're in that situation now, and the governments are laying down their arms. They're doing exactly what you should not do. And they are paving the way for the Delta strain to sweep the world and to generate new variants that could be worse. All right, let's get into the first article. This is from CNBC. Actually, all these are from CNBC. This one's called "England Takes Leap into the Unknown, Lifting COVID Rules as Cases Surge." This is from Holly Elliott, published Monday, July 19, 2021. I'm just going to leave that screenshot up there while I read the article. So, this is from London. England took a step into the unknown on Monday, lifting nearly all remaining restrictions on public life at a time when coronavirus infections are high and rising. There are no more limits on indoor gathering. Also, nightclubs can reopen. The 1 meter social distancing rule has been removed. Comment, in the US it was 6 feet, so more like 2 meters. They can't even handle 1 meter over there. And masks have become largely voluntary, although some airlines and transport companies have said they will retain mask requirements. In essence, the majority of legal restrictions have now been lifted and replaced with an emphasis on personal responsibility as infections continue to rise. Comment, you cannot rely on personal responsibility in a situation like this, which is literally life and death for some of the people who get COVID. And it's also long-term injury for more people who get COVID. Look up long COVID or COVID long haulers. There's a whole, nerve symptoms, smell, appetite, fatigue. There's all kinds of things. Lung damage, kidney damage, blood clots. Not things you want, things you want to avoid. And this is not how public health works. You have tools. Anyway, this is insane. This is insane. Continuing. There was no mention of, quote, Freedom Day as July 19 had previously been dubbed. Prime Minister Boris Johnson urged caution as the country moved to step 4 of its roadmap of lifting restrictions. Quote, "Please, please, please be cautious. Go forward tomorrow into the next step with all the right prudence and respect for other people." Good luck with that. "And the risks that the disease continues to present," unquote, Johnson said in a statement Sunday night. The lifting of restrictions had already been moved from June 21st to allow for more vaccinations amid a surge in cases caused by the spread of the highly infectious Delta variant. COVID infections remain high across the UK, with 316,691 cases reported over the last 7 days. Jesus. Up 43% from the previous 7-day period. Comment. So 317,000 cases in a week, and that's almost a 50% increase from the previous week. Well, these things, they don't suddenly abruptly change course from week to week usually, so you can expect that for the next few weeks. Hospitalizations continuing are low, but are creeping higher, with 4,313 people admitted to hospital in the last 7 days, government data shows. In the last 7 days, 283 people have died. The vast majority of infections are currently among younger age groups who are not yet vaccinated or are only partially protected. Comment, meaning they just got 1 shot instead of 2. And they're going to be rolling out a 3rd shot. That's kind of all they've got is these, get one of these shots every few months kind of thing. COVID's a very strange illness. It affects blood vessels. It affects all kinds of parts of the body. It's, researchers are trying to study it as quickly as they can. These shots are the best that we have right now. And people, well, we'll get to that in the next paragraph. So continuing. Recent events like the Euro 2020 soccer championships, which saw England fans gathered in pubs and bars around the country, have also been blamed for the rise in cases. Comment there. This is another interesting note because right now, I think one of these articles is going to talk about it. There's a gender or sex discrepancy because more men were getting together for these soccer or football championships. And there's like a spike in cases among men. And it's probably because these were super spreader events. So continuing, at the same time, the government continues to plow on with vaccinations. So commenting again, I'm commenting a lot. The U.S. right now has like a little bit over 50% or like thereabouts vaccinated. This is not good news for us in the U.S. because we're about to hit the UK vaccination statistics. And, well, to continue, to date, 87.9% of UK adults have received a first dose, and 68.3% of UK adults have received both doses. Having both doses of a vaccine greatly reduces the risk of infection and hospitalization caused by the coronavirus. So my comment there is that is a substantially higher number than the US. So if it's spreading like that in a country with that high of a vaccination rate, 88% have gotten 1 dose and 68% got 2 doses, it's going to spread even worse because we see where are the COVID hotspots in the U.S.? Mostly places with very low vaccination rates. Actually, I have a list right here. So some sustained hotspots around the U.S. as of last week. Sustained hotspots are places, off the top of my head, I believe that this is places with 10% or higher test positivity for a certain period of time. So in other words, test positivity, those are people going in for tests and turning up positive. So greater than 10% test positivity means 100 people got a test, 10 or more were positive. So You want, well, lower than that. But there are counties across the U.S. and some states with clusters of counties, including Clark County, Nevada, and Northeast Arizona, which borders it, Northeast Texas, and then other counties in West and South Texas. Missouri and Arkansas have a bunch of counties that are sustained hotspots. There's a county in Southeast Washington, county in Southeast Wyoming. Florida has several counties. Northeast Alabama, Central Virginia, and East Kentucky all have sustained hotspots. That is just going to keep growing. And we'll get to the impact in the U.S. in another article in this. So, getting back to the UK article. Experts have cautioned that hospitalizations could rise substantially over the coming weeks, however, and scientists have criticized plans to ease almost all COVID restrictions, calling it unethical and dangerous for the entire planet. Others have defended the move, saying that there are many damaging consequences to remaining locked down, from the impact on the economy and livelihoods to mental health. Well, a quick comment. First of all, no jobs on a dead planet. Also, as far as mental health, I think that dying also, risk of death and injury from COVID also is a mental health factor. This is just, die for the Dow proponents basically saying, reopen and, what about mental health? Yeah, because you care about our mental health so much when you're flooding us with advertising and exploiting us and, all the other things that they do to us in a systemized and organized way. Anyway, I hear Jimmy Dore. I haven't been listening to Jimmy Dore really for months now, but last time I heard him making the mental health and the small business argument a million times for COVID. And I'm sorry, capitalism is not a good system. There's too much personal risk. And if small business owners are feeling the hurt, then rally for the government to bail you out or something. Because just staying open is not a fucking option when the virus... viruses, I've said this before, you can't reason with them. You can't negotiate with them. You have to deal with them on their terms, just like a flood or a wildfire. You can't, plead with them or make a bargain. You just have to deal with it like a natural disaster. And if you don't, the virus spreads, and every time it takes over a human body, it multiplies, spreads to other people, and every time that DNA is reproduced, there's subtle mutations. Sometimes there are significant ones which give the virus an advantage. And now that it's spreading among vaccinated people, which that's true, vaccinated people carry COVID, it gives an advantage to mutations that work in vaccinated bodies. So the virus, the more it spreads, the more it can adapt to these conditions. Every mutation is that virus rolling the dice again. It's not conscious as far as we know, but it's every time it multiplies, the dice are rolled, because there are little mutations in it here and there with errors and everything else. And sometimes it comes out more virulent, more vaccine resistant, etc. So you can't just say, oh, this is acceptable, because it will not go away. The virus is not a static thing. It can become much more serious the more that it spreads. So anyway, this is just insane. So continuing, in a statement Sunday evening, the British government acknowledged that cases continue to rise, but noted that the link with hospitalizations and deaths was, quote, substantially weakened due to the vaccination program, as it urged all adults to come forward for both vaccine doses. So, again, the U.S. is lagging far behind the U.K., and they're still having problems there. We'll see in the coming weeks, just how resistant, a largely vaccinated UK is to this Delta thing that's going to explode. Mark my words. There's no way it won't. At least to some level, it's going to get much, much, much bigger than it is now. All right, continuing. Deutsche Bank research strategist Jim Reed noted on Monday that, quote, the world will be watching the UK experiment with huge interest. It could show a pathway back towards normality, or it could be a warning to even heavily vaccinated countries that COVID will be a problem for a decent length of time still. Ahead of this symbolic day, UK new cases dipped below 50,000 yesterday after 2 days above. The weekly growth rate is still strong, though, Reed added. Breaking down the numbers, the big growth area over this period has been males aged 15 to 40. It's the first time in the pandemic that there's been a notable gender split. It strongly hints at the impact of millions of football fans watching the Euro football final at various venues around the country, unquote. Callum Pickering, senior economist at Berenberg Bank, told CNBC on Monday that the economic impact of reopening was uncertain, given that consumer behavior could be affected by the reopening, with some consumers more nervous about the lifting of restrictions such as mask wearing. Quote, I doubt we'll get a bounce, but I think we'll get a continued uptick in economic activity. But some of those uncertainties are certainly big ones, he told CNBC's Squawk Box Europe. We're going to have to take a look at some of the high-frequency data, mobility statistics, and the like to see actually what are the effects of the uncertainty of opening up and removing masks, and does that actually deter people from going out onto the high street and restaurants and supermarkets, unquote. Comment, for me, it absolutely deters me. I have not been out to eat since, I also can cook, but I haven't been out to eat since the beginning of the pandemic. So yeah, for me, it absolutely has. What about you? Leave a comment. Continuing, Johnson, who nearly died from the coronavirus in April 2020 and is currently self-isolating after coming into contact with COVID-infected Health Secretary Sajid Javid, defended the reopening on Monday. Comment, just pause right there. Boris Johnson nearly died from COVID last year and is currently self-isolating after... And then his statement before has 3 pleases at the beginning, begging people to be, quote, responsible. Well, tell you what, best way to ensure that is set it as a rule. That way, because people are going to break the rule regardless. But if you don't even have the rule, that's much less encouraging. Okay? We need leadership here. Again, finance capital in particular, capital in general, sets policy for the UK government and the US government. And this is what they need and what they want. But even a fucking tool like Boris Johnson knows this is a horrible move, and you can hear it. So, quoting Johnson, if we don't do it now, we've got to ask ourselves, when will we ever do it? I don't know. Maybe when you're not in the grips of a massive COVID spike that is just 20 points behind where you were at the peak in January and rapidly on track to hitting that and maybe overtaking it. Continuing the quote, this is the right moment, Johnson said in a video statement, quote, but we've got to do it cautiously. We've got to remember that this virus is sadly still out there. Cases are rising. We can see the extreme contagiousness of the Delta variant, unquote. I'm sorry, but your policy doesn't match the reality. Johnson said that there was a, quote, immense consolation and satisfaction that COVID vaccines have, quote, very severely weakened the link between infection and hospitalization and between infection and serious illness and death. The government said it would continue to review all data. It also said it will, quote, reinforce vaccine defenses by reducing the dosing interval from 12 to 8 weeks for all adults, will continue to use its test, trace, and isolate system, and that border controls will be maintained, including quarantine for all those traveling from a red list country and for amber list countries, unless individuals are double vaccinated. Quote, data will be continually assessed and contingency measures retained if needed during higher risk periods, but restrictions will be avoided if possible. Well, that's the end of the first article. I'd like to see how long this lasts because I think, and if you're in the UK, just I would say stay out of the public as much as you possibly can, because the next few weeks are not going to be good. All right, so hitting the next article, this is from the 16th, and this is by Chloe Taylor. The headline is England's lifting of COVID lockdowns is a danger to the entire world, experts warn. So this is more of a science-based rebuttal to this insane policy. Let's read. From London, global scientists have criticized the UK government's plans to ease almost all COVID-19 restrictions, calling it unethical and dangerous for the entire planet. Gathering at a virtual summit on Friday, leading scientists and government advisors from all over the world warned that Britain was heading for disaster by removing most of its remaining restrictions on Monday. The event came as more than 1,200 scientists backed a letter to the Lancet Medical Journal in which UK Prime Minister Boris Johnson's plans were dubbed, quote, dangerous and premature, unquote. England will see most of its last remaining restrictions, including mandatory mask wearing and social distancing, removed on Monday, which Johnson said will be a, quote, irreversible, unquote, move. We'll see about that, because I think people are not going to be super happy about the effects about a month from now. Johnson has fiercely defended his new strategy and has argued that now is, quote, the right time to proceed, before the weather turned colder and as, quote, the natural fire break of the school holidays approached. Quote, it is absolutely vital that we proceed now with caution. We cannot simply revert instantly from Monday to life as it was before COVID, he said at a press conference Monday. Comment, that's exactly what people are going to try to do. People following your lead who don't know better. There's a lot of people out there who don't know much about health science, and they're going to say, well, the government said this, even if they're confused, even if they think intuitively, hey, maybe masks are still a good idea, they're going to be confused. And then the people who just simply don't give a shit are going to be running amok. As far as this whole now is the right time to proceed before the weather turned colder and with the natural fire break of the school holidays, I guess summer vacation, what are you talking about? I mean, how is that going to be better versus not? Like, you're going to have to revert in the fall. I don't really understand the logic there. Anyway, continuing, speaking on Friday's panel, Christina Pagel, director of the Clinical Operational Research Unit of London's UCL, warned that there was potential for a new variant of COVID to emerge this summer. Quote, any mutation that can infect vaccinated people better has a big selection advantage and can spread, she said. And because of our position as a global travel hub, any variant that becomes dominant in the UK will likely spread to the rest of the world. We saw it with Alpha, and I'm absolutely sure that we contributed to the rise of Delta through Europe and North America. The UK policy doesn't just affect us, it affects everybody. Everybody has a stake in what we do, she added. Clinical epidemiologist Deepti Gurdasani, who also attended the summit, agreed, saying on Twitter before the event that, quote, the world is watching the current avoidable crisis unfold in the UK. Michael Baker, a professor of public health and a member of the New Zealand Ministry of Health's advisory group, said he was, quote, amazed by the British government's plans to lift almost all restrictions on Monday. Baker suggested the UK government seemed to be reverting to a herd immunity approach, which he dubbed, quote, completely unacceptable, arguing that the strategy had, quote, failed dismally around the globe, unquote. And yeah, that's true. It has failed dismally. Also, as far as herd immunity, in the UK, 68% of people have gotten both shots. And I think it was, 88% of people? I can't remember 5 minutes ago. 88% of people, I think, got at least one shot. That's way higher than in the US. And if you've got a population like that and Delta's still spreading, clearly this herd immunity thing, I mean, it's just not how we're going to stop it. It's not how we're going to stop it. So if we're interested in stopping it, You have to stop it from fucking spreading. You have to let it die out and stop hopping from person to person, particularly as quickly as it's doing. That's how these things work. So here's another example from somebody who's doing something right. China. Go look on CGTN. They have a YouTube page. What they're doing about COVID. I remember like over a month ago, there was an outbreak of COVID in a neighborhood. They shut down the entire neighborhood, and there's footage of people like spraying disinfectant on like the streets. Like they took it so seriously. That's how you actually deal with this. That's how you actually contain it. Anyway, it's I'm tearing my hair out reading this because it literally is, imagine going back to November 2020 and telling people what was coming. And it's just totally avoidable. All right, anyway. New Zealand has widely been seen as successful at suppressing the coronavirus within its borders, and life in the island nation has returned to a state of relative normalcy. The country currently has 48 active cases. That's not bad. All of which were found in people entering the country, and 9 of which were reported in the last 24 hours. There are 0 cases within the community, according to New Zealand's Ministry of Health. William Haseltine, a U.S. virologist and chair and president of Access Health International, told the panel at Friday's summit that the world had, quote, always looked to the UK for great sensible policies, unquote. Maybe that's in the health realm. I don't know. UK also has a little bit of genocide and empire on its hands, but also kind of public health crises, war, and anyway, continuing. Quote, unfortunately, that has not been the case for the COVID pandemic, he said. What I fear is that some of the worst impulses in many of our states will follow the UK example. Haseltine slammed so-called herd immunity strategies, where populations are allowed to build up natural immunity to an illness through exposure to it, as, quote, murderous. Quote, I think that's a word we should use because that's what it is. It is knowledge that you are doing something that will result in thousands, and in some cases tens of thousands of people dying, he said. It is disastrous policy. It's been clear that that's been the case for some time, and to continue to espouse that policy is unconscionable, unquote. Jose M. Martin Moreno, a professor of public health at the University of Valencia in Spain, echoed Haseltine's concerns about other parts of the world following the UK's lead. Quote, we cannot understand why this is happening in spite of the knowledge that the UK has, he said, cautioning that other countries may begin to mimic British policies. Quote, if we remove the tools that contain the transmission, this is it, he added. That is what I've been telling you. When I say, I don't see how there won't be a massive outbreak, because it's just like if you have a river that's been dammed up and you remove the dam, the water follows, it flows with gravity and it flows. And anything in its way gets flooded. It's like if you have a fire and then you leave a trail of fuel, the fire is going to follow the fuel. It's the same thing with a virus, which is a mindless, not even really alive piece of encapsulated genetic information, which just jumps from person to person and does its thing. You can't reason with it. And just like this person says, if we remove the tools that contain the transmission, that's it. That's very, very, very predictable results. Continuing, Yanir Bar-Yam, president of the New England Complex Systems Institute and founder of the World Health Network, said that now was the time for governments to act, but in the opposite direction of British lawmakers. Quote, opening up when the pandemic is still propagating doesn't make sense for protection of the public, he said. Everybody is affected once the pandemic is out of control. Meanwhile, Shu Ti-Chu, founding president of Taiwan's Health and Sustainable Development Foundation, said it was unethical to, quote, take the umbrella away from people without a raincoat while it's raining very hard. She also raised concerns that with children unable to be vaccinated, very good point, they would be, quote, left behind due to the high prevalence of long COVID among young people. However, there were also warnings that even those who were fully vaccinated would feel the impact of high transmission rates. Comment, these are called breakthrough cases. It's a case of COVID that breaks through the vaccine, and it's fairly common. Meir Rubin, a lawyer who advises the Israeli government on risk management, warned that, quote, even the best vaccines are only a tactic and not a strategy. In one region of Israel, he noted, more than 80% of the population had been fully vaccinated with the Pfizer-BioNTech vaccine, but there had still been a, quote, serious outbreak of COVID. Rubin told the panel that without eliminating the virus, even a vaccinated population could, quote, collapse under the next variant. Quote, an infectious carrier of the Delta variant will infect his family even when they are fully vaccinated. If you live with a child who is a Delta carrier, he will infect the parents, he said, adding that Israel was seeing serious cases and hospitalizations even in fully vaccinated patients. Hazeltine also noted that vaccines alone would not bring an end to the pandemic. Quote, even if you are fully vaccinated, you must follow serious efforts and control to try to eliminate, not just mitigate the problem. Policies that open up the country in the midst of a growing wave of infections are counterproductive in the most extreme, he warned. That's the end of that article. I couldn't agree more. Like, literally, it's like saying, okay, well, we've got however many millions of gallons of water dammed up in this lake now. We've stopped the flooding, and I think it's time to remove the dam. And it's like, well, no, because then it'll just reflood. This is, not really brain surgery. So continuing, I got a few more articles. This one's called The COVID Delta Variant Has, quote, exploded in the UK, and it could be a blueprint for the US. This is from about 3 weeks ago, Monday, June 28th. And I like comparing these articles, from 2 weeks ago, 3 weeks ago to now, because you see how fast this thing moves. Like, the timing is critical, especially with Delta, because it moves so fast. And, mistakes for 2 or 3 weeks can end up being catastrophic because, like in a month, the UK has set themselves back 6 months in terms of the number of cases per day. And that's just getting worse. So, big mistakes can have huge consequences in a scenario like this. So getting into this article, again from London, since the start of the coronavirus pandemic, the US has been keeping a close eye on the UK. From its initial response to COVID-19, questioned by many, to its much praised immunization program and world-class research, all have helped inform how the US, which faced its first major COVID outbreak after Britain, has reacted. Indeed, the UK's experience of COVID-19 has often been a harbinger of things to come for other countries, including the US. It has proved particularly true when it comes to COVID variants, which have hit the UK and then gone on to dominate globally. This was first seen with the Alpha variant that emerged in southeast England late last year and went on to become dominant across the world. A similar thing then happened with the Delta variant that originated in India but was identified in the UK at a relatively early stage. Both strains have proved to be far more transmissible than the original coronavirus that first emerged in China in late 2019. Comment there. I also have read reports that they found examples of COVID in Italian sewers in the fall of 2019, so it's a little bit debatable where it actually came from as far as I understand. Anyway, continuing, the World Health Organization now predicts that the Delta variant, which has already spread to more than 80 countries, will become the dominant strain of the disease worldwide. Given the UK's experience of both strains at an earlier stage than many other countries, it is now being seen as something of a test case for what could happen in the US. The first thing to note is how quickly the Delta variant spread across the UK. In a relatively short amount of time, the strain supplanted the Alpha variant to become dominant in the country. In mid-June, Delta was responsible for 90% of all infections, a government study showed. And this happened despite the UK's advanced vaccination rate, just like I was saying. Meanwhile, cases attributed to the Delta strain now make up around 20% of newly diagnosed cases in the U.S., according to White House Chief Medical Advisor Dr. Anthony Fauci. Fauci warned last week, so keep in mind, commenting, this article is from June 28th, Delta is now the dominant strain in the U.S., and that's the next article we're going to read. But so this is just from June 28th, and Delta was 20% of the cases in the U.S., and it's now dominant. So keep that in mind. Fauci warned last week that the Delta variant is set to become the dominant COVID strain in the country in a matter of weeks. That was true, citing the UK as precedent. Quote, it just exploded in the UK. It went from a minor variant to now more than 90% of the isolates in the UK, Fauci said on NBC's Today Show. He said the variant has a doubling time of about 2 weeks. Quote, so you would expect just the doubling time, in several weeks to a month or so, it's going to be quite dominant. That's the sobering news, he added. Fauci had already warned that Delta appears to be, quote, following the same pattern as Alpha. Quote, similar to the situation in the UK, the Delta variant is currently the greatest threat in the US to our attempt to eliminate COVID-19, he said. And I want to comment on that because, the vaccines and all that, if Delta hadn't emerged, maybe we would actually be set to reopen at this point. Because, the original COVID, it could be that it would have been contained by everything up till now. Like, it could be that the original COVID, we'll never really see it again. But Delta is like Pandemic 2, son of Pandemic. Quite literally. I mean, it's a mutated offspring of COVID. Anyway, and it's just plowing. I think that basically, if the first wave of COVID started a year and a half ago, that's basically it. It ran its course in 18 months, and now we're getting the Delta wave. And, I guess Delta really was kind of taken off in India. So, yeah, it was about a year later, a little over a year later, back in the spring. And this was responsible for 350,000 cases in a single day in India. So how bad can it get? Bad is how bad. So anyway, in the UK, infections attributed to Delta have spread rapidly among young people and anyone older who has not yet been vaccinated. Similarly, in the US, there are concerns that Delta could rapidly spread in parts of the South where vaccinations have stalled. Comment, I've done a video on that. That was our last COVID update. A lot of the U.S. states have like 35% vaccination, 40% vaccination. It's not good enough, okay? That's how you get a hot spot. And then people who are unvaccinated, they have higher viral loads. The virus multiplies more freely in their bodies, so they're more likely to spread it to other people. Vaccinated people can still spread COVID. You have lower viral loads, but you have enough to spread it. There are many cases where in epidemiological studies, if you want to check out Eric Feigl Ding, I think it's Dr. Eric Ding on Twitter, does great daily coverage of this. But there were studies where I think it was out of like 30, they studied a network of cases where people transmitted COVID, I think specifically Delta. And it was like 20 out of the 30 transmissions that they tracked had at least one vaccinated participant, either the spreader or the receiver. So again, understand what vaccination means. It means it lowers your risk of getting COVID, and it lowers your risk of having a really severe case of COVID. Lowers risk. It does not eliminate the risk. So you can still spread it, you can still contract it, and you can still have a serious case of it if COVID just happens to take a shine to your particular body. But, get the vaccine. It's going to lower your odds. Just don't think you're bulletproof, because you're not. Keep wearing masks, keep distancing. I think it's just, you get a lot of people like, oh, I'm not afraid of COVID. I mean, A, you should be, but B, whether you're afraid of getting COVID or not, or dying from it, or having long-term health consequences from it or not, you can spread it to people who don't want it. And you may end up killing those people by spreading it to them. Is that what you want? It's not what I want. Anyway, continuing. The US is not alone in its concern over the Delta variant. In Australia, Sydney was put under a 2-week lockdown over the weekend amid a growing outbreak of the strain. The Australian government's COVID response team is set to meet Monday to discuss the spread of the virus and the possibility of more restrictions. New outbreaks of infections, largely blamed on the Delta variant, have prompted the UK's government to speed up the last leg of its immunization program for people aged 18 and over. It's hoped that stepping up vaccinations will help stop the wild spread of the strain. Analysis from Public Health England, released June 21st, showed that 2 doses of the Pfizer-BioNTech or the Oxford-AstraZeneca COVID-19 vaccines are highly effective against hospitalization from the Delta variant. To date, almost 60% of all UK adults have received 2 doses of the vaccine, while in the US, 56% of the population over 18 has been fully vaccinated. So 56%, that was the stat I was looking for earlier. The UK has not yet authorized COVID shots for adolescents, unlike the US, which is giving vaccines to the over 12s. Comment, and they haven't studied that super closely yet as far as the safety. I mean, they okayed the vaccines on an emergency basis because it is an emergency. COVID is an emergency for older people. And it does seem to be largely safe so far. They've delayed approval for younger people in the US because A, younger people are the least likely to get severe COVID, and B, if there was something wrong with the shot, younger people would stand the most to lose because they still have the most of their natural life left. You don't want to give kids something that is being approved on an emergency basis unless you have to. However, I would suggest my whole point in this is that it's become more of an emergency to give vaccines to people between 12 and 18 because of the stupid policy of reopening. And there's no reason for people not to be wearing masks. Wear a fucking mask. It costs you nothing. Nothing. Just wear it and keep distancing. Stay away from dense crowds. You don't want to be in a dense crowd. When we look at simple public health measures, things like hand washing, food refrigeration, sanitation, there's such easy, low cost, common sense things for everyone to do, which everyone can participate in. They have greatly lowered incidence of disease and contributed to increased lifespan, versus 100 years ago. And here, the U.S. is just thumbing its nose at mask. Who needs a mask? Well, everyone needs a mask. It's just a little piece that just put it. I mean, by now, everyone could have N95 masks, which are really effective against, microbes. Some of the masks that people wear, it's really just effective against spittle, basically. Which would we rather do? Wear a really effective mask for a year and a half, and then have COVID completely go away? Or would you rather just drag it out for, 3 or 4 years? There's no end to this thing in sight. I've called the current period an eye of the storm. I'm standing by that. I think that that's accurate. Anyway, continuing. Perhaps wary of how infections have spread in the UK, the US wants to speed up its vaccinations too. It could take more time than the White House would like, however. The Biden administration said last Tuesday that it likely won't hit its goal of 70% of American adults receiving 1 vaccine shot or more by the 4th of July. Well, that's come and gone. White House COVID czar Jeff Zients, not familiar with that name, said that the administration had met its 70% target for people aged 30 and older and is on track to hit it for those aged 27 and older by July 4th. Zients said that U.S. officials were working with state and local leaders to reach younger people. We think it'll take a few extra weeks to get to 70% of all adults with at least 1 shot, so already moving the goalposts, with the 18 to 26-year-olds factored in. So Anyway, we're not there. And it's just. Anyway, that's the end of that article. I'm just shaking my head because, again, it's like feel the eerie calm. I can't stop thinking about this because I'll be happy, again, if there's some random fork in the road and, Delta takes the other road. But if it doesn't, man, we are so fucked. I can't even explain. So it's going to be worse than last year because Delta is significantly worse. Just, it'd be like before you were, using wads of paper as your fuel for the fire, and now we're using gasoline. It's just innately worse. So, all right, let's move on to the next article. This is again from CNBC, July 7th. So just a couple of weeks ago. I think I referred to July 7th as last week. I'm having trouble keeping up with the time. The summer is moving fast for me. All right, this is by Berkeley Lovelace Jr. Now, let me just, on a lighter note, that is a great name. I had to pause and read that more carefully. It's like Berkeley Lovelace Jr. Nice. All right, so headline. CDC data shows highly transmissible Delta variant is now the dominant COVID strain in the U.S. So that is as of 2 weeks ago. See, that didn't take long at all, did it? So the article says the highly transmissible Delta variant is now the dominant coronavirus strain in the United States, surpassing the Alpha variant, according to COVID-19 modeling data released by the Centers for Disease Control and Prevention. Delta, the variant that was first found in India and is now in at least 104 countries, represented 51.7% of new COVID cases in the U.S. over the 2 weeks ending July 3, according to recently updated estimates by the CDC. Meanwhile, the proportion of new cases caused by Alpha, which was first found in the UK, was just 28.7 over the same time period, according to the U.S. agency. It's 28.7%. In recent weeks, U.S. health officials have warned that Delta was on track to become the dominant variant in the U.S., as its prevalence in the nation doubles about every 2 weeks. What is prevalence? Prevalence is the number of instances of a disease at any given point in time. Incidence is similar to prevalence, but incidence is the number of new cases. So prevalence is you're just taking a sample, and that's how many people have it at that time. They could have gotten it last week, or they could have gotten it a year ago, but they have it currently. Incidence is new cases. Okay. The prevalence of Delta doubles about every 2 weeks. So this is prevalence of Delta is its sustained lifespan, basically. So it's been doubling every 2 weeks. There is twice as much Delta in the country every 2 weeks. On June 22nd, a little over 2 weeks ago, White House Chief Medical Advisor Dr. Anthony Fauci said Delta made up about 20% of all new cases in the U.S. The World Health Organization, which has called Delta the, quote, fastest and fittest variant yet, expects it to become the dominant form of the disease worldwide. Delta is estimated to be about 55% more transmissible than the Alpha variant, according to a report by the World Health Organization. So let's pause here for another second. Talk about R values. What's an R value? So in the field of infectious disease, such as COVID, R is a measure of transmissibility. So the average flu has an R value of about, I think it's 1.25. R is the number of people an infected person is likely to infect. So the average flu is like 1 to 1.25. So a person with the flu is likely to infect 1 or 1.25 people. So yeah, that's how transmissible it is. COVID-19 has an R value around 2.5. It's like 1.5 to 3.5 depending on conditions, but average about 2.5. So it's about twice as transmissible as the flu. And what about the Delta variant? It's between 5 and 7. So it's probably 5 to 6, although if it's just allowed to spread, the R value, it's like that's depends on a lot of factors. It depends on whether your society is trying to control it or not. That's going to affect how many people get infected by every person who has it. So, measures like masks and distancing and hand washing and all that stuff, that helps to keep that number down. Also vaccinations, because while a vaccinated person who gets infected can spread it, they have a lower viral load. So that may lower the R value. But original COVID classic has a 2.5. That's how many people you're likely to infect on average. Delta, several times higher. So, that adds up quickly when you start multiplying these numbers. It really adds up quickly. And then remember that, out of those 5 to 7 people, then they're going on to infect more people. The whole thing moves very rapidly. So anyway, continuing. President Joe Biden on Tuesday once again pushed for all eligible Americans to get COVID vaccinations, stressing the importance of being protected against Delta. Despite the U.S. being on track to hit 160 million people fully vaccinated in the coming days, Biden said millions remain unvaccinated against COVID, quote, and because of that, their communities are at risk, their friends are at risk, the people they care about are at risk. This is an even bigger concern because of the Delta variant, the president said. And another comment, I was just reading an article, I don't have it here, but out of Houston, 99.75% of the people hospitalized and dying in Houston were unvaccinated. So it definitely helps to curb your odds of landing in the hospital and dying. It doesn't make you bulletproof, but it does reduce your odds. There are still about 1,000 counties in the U.S. that have vaccination coverage of less than 30%, CDC Director Dr. Rochelle Walensky told reporters last week. The counties are mostly located in the Southeast and Midwest, she said, and the agency is already seeing increased rates of disease in these places due to further spread of the Delta variant. Scientists and other health experts fear the variant will cause a surge in new cases this fall, hitting those who remain unvaccinated the hardest unless states can vaccinate more people. Quote, I think there are two Americas, said Dr. Paul Offit, a pediatrician and vaccine advocate who has served on advisory panels for both the CDC and the Food and Drug Administration. Quote, there is the vaccinated America and the unvaccinated America, and I think the unvaccinated America is about to pay a price for that. The White House announced last week that it is deploying COVID-19 response teams across the nation focused on combating the variant. The teams, composed of officials from the CDC and other federal agencies, will work with communities at higher risk of outbreaks. So that's the end of that article. I just got one more for you, and while I'm bringing it up, I'll just say, I know that there are certain vulnerable communities who may be wary of the we're from the government and we're here to help, or being experimented on and things like that. I get that. The capitalist-run government of the United States has a horrible track record of experimenting on poor and vulnerable people, particularly people of color. That said, I have not heard anything so far about people of color having, higher incidence of problems with the vaccines or anything like that. If anyone's aware of that, please share it. I'm happy to cover that on the channel here. But really get the vaccine. They're free, for God's sake. This is just bigger than you or anything else. If COVID keeps spreading, Delta might just be the beginning. And that's not fear-mongering. We're already at Delta. Let's not go further. All right, so final article is not so much about the spread, but just something practical. This is by, again, Holly Elliott. The headline is Headache, Runny Nose. These are among the top 5 COVID symptoms, study says, or the new top 5 COVID symptoms. So let's read this article, just, so that people know what to look out for. So when the coronavirus pandemic first emerged in early 2020, governments quickly put out information on what symptoms to look out for, little knowing then that much of the transmission was asymptomatic. The public was told to look out for a high temperature and a new continuous cough, with a loss of taste or smell, fatigue, and a sore throat, also named as possible symptoms, some added at different points in the pandemic. Fast forward to the present day, and more symptoms are being reported and recognized. The variation in symptoms has happened over time as several variants of the virus, such as the Alpha strain and now the highly transmissible Delta variant, have gone on to replace the original strain of COVID-19. Now, an ongoing UK-based study which enables the public to enter their COVID symptoms on an app, which enables scientists to then analyze the data, says that there are new coronavirus symptoms being widely reported. The Zoe COVID Symptom Study has identified the current top 5 symptoms that have emerged in recent weeks, which seemingly differ depending on whether you've been vaccinated and how many doses you've had. The symptoms highlighted below were first published in late June, but still represent the top 5 symptoms being reported, the Zoe COVID Symptom Study told CNBC Wednesday. The symptoms rankings are based on members of the public's reports in the app alone and do not take into account which variant caused the virus or demographic information. These are the top 5 symptoms being reported by people who are fully vaccinated, have had 1 dose of a vaccine, or are unvaccinated. So they start with the symptoms among people who've had 2 vaccinations, are fully vaccinated. It says that generally it has seen similar symptoms of COVID-19 being reported overall in the app by people who had and who hadn't been vaccinated, but fewer symptoms were reported over a shorter period of time by those who had already had the shot, suggesting that they were falling less seriously ill and getting better more quickly. So another way of saying that is that the vaccines seem to reduce both duration and severity of the COVID symptoms. Here is the current ranking of COVID symptoms after 2 vaccinations. 1, headache. 2, runny nose. 3, sneezing. 4, sore throat. And 5, loss of smell. The study noted that traditional COVID symptoms, such as anosmia, or loss of smell, fever, and shortness of breath ranked way down the list at 5, 12, and 29, respectively. Quote, a persistent cough now ranks at number 8 if you've had 2 vaccine doses, so it is no longer the top indicator of having COVID. So again, if you are vaccinated, headache, runny nose, sneezing, sore throat, and loss of smell are in order the things you're most likely to experience if you get COVID again. So the symptoms after 1 vaccine dose are similar, but they change a little bit. So the ranking changes after 1 dose of the vaccination. Number 1, headache. Number 2, runny nose. So those are the same. Number 3 is sore throat. Number 4 is sneezing. Number 5 is persistent cough. So again, comparing the 1 vaccine dose people to the 2 vaccine dose people, you're more likely to get a sore throat than the sneezing. Those have switched. And then loss of smell is no longer number 5. A persistent cough is. So the cough and the lung damage is like usually what people die from. And it does look like the second dose knocks the cough down the list. So, that could be very important. All right. And then finally, symptoms if you're unvaccinated. If you've not yet been vaccinated, then the symptoms are more recognizable to the traditional ranking. However, we can still observe some changes from when COVID-19 first appeared over a year ago. Number 1, if you're unvaccinated, headache. Number 2, sore throat. Number 3, runny nose. So that's all similar. Number 4 is fever. And number 5 is persistent cough. So number 5 is persistent cough in both unvaccinated and 1-dose people. And then fever has crept into the list, and you don't get the sneezing as much as you get the fever. So in the unvaccinated people, quote, loss of smell comes in at number 9, and shortness of breath comes far down the list at number 30, indicating the symptoms as recorded previously are changing with the evolving variants of the virus. COVID cases attributed to the much more contagious Delta variant are surging in parts of Europe, the UK, and the US, particularly among young people and the partially vaccinated and unvaccinated. While 2 doses of the Oxford AstraZeneca or Pfizer-BioNTech vaccine provide protection against the Delta variant, both were significantly less effective after only 1 shot. The latest research from Israel on Monday found a decrease in the effectiveness of the Pfizer BioNTech vaccine in preventing infections and symptomatic illness coinciding with the spread of Delta, but said it remained highly effective in preventing serious illness. So there's another link to an article, that's the end of that article, titled "The Delta Variant is Spreading in Europe and Can't Be Stopped." I kind of wish I had picked that one up for this video, but you get the point. This is a gigantic problem. I've said before, I just don't see how. They make all this progress. They have us suffer. I mean, the people in power didn't have us suffer, but we had to suffer through COVID. It was a hard time for everybody. We make all this progress, and then the governments remove all the restrictions and they tell people to start behaving in a way that is going to spread any cases that do exist. So really, like I said, the UK, they lost 6 months of progress in 1 month. And they're on track to surpass their peak currently. The curve is going straight up. And will this happen in the US? Yeah, probably in another month. So whatever you're doing, for the summer, do it now, as in this week or next week, because this is probably going to be a volatile situation. I don't even know if we're going to make it to fall before this breaks out. Fall's 2 months away. So I don't know. Like I said, enjoy yourself while you can, because I think this fall is going to be probably a shit show. Anyway, as far as comments, do you live in any of these areas? What are you seeing? Let us know in the comments. That's always interesting and informative. So otherwise, we'll keep doing these COVID updates. I don't know, maybe every other week or something like that, whenever I see an article that seems newsworthy. But I got to tell you, for me personally, I can't help but worry. I see Biden's miserable leadership out there, and the CDC refusing, even prompted, seriously, asked recently, are you sure you don't want to tell people to wear masks? And they're like, yeah, don't wear masks. I mean, they could have just not doubled down, but they did. And I think it's just going to end up costing all of us. I hope I'm wrong, but I got to say, I got a real bad feeling about this one. And I don't know, it's totally, well, the severity at least is totally preventable. We need to be working a lot harder to knock this thing down, particularly Delta. It was a lot of work to knock down the first iteration of COVID. It's going to be even harder to knock down Delta, So this thing could wind up taking out what's left of the system at the knees. As far as the economy and all that stuff, I would say don't engage in panic buying. But you might want to, on your next few grocery trips, get an extra thing of toilet paper, get an extra thing of staples that don't go bad. You might want to just casually start stocking up a little bit more now, because, if things set in a couple of months, you'll be a little more prepared. And if there are any shortages, they won't hit you as badly. Don't, though, go to the grocery store and buy 18, packs of toilet paper, because there are studies on that, and panic buying like that is a vicious cycle and a chain reaction. And even if somebody thinks that there's going to be a shortage, everybody else starts behaving, whether there's a good reason for it or not, underlying reason, whether there's a real shortage or not, people start overbuying, in fear that, somebody else is going to overbuy more first. So, like I said, just pick up an extra whatever, but just one at a time. Don't, freak everybody out. But you might want to build up a small stockpile at home. There are already some murmurings in the mainstream news about, another toilet paper shortage and stuff like that. Because again, it's not just, oh, we ran out of trees or paper or whatever. It's that demand massively overwhelms supply. And then the supply chains can't accommodate 20 times the normal demand. They just can't produce them that fast. So again, get 2 instead of 1. And, maybe do it every time. And then, after a month, you'll have a little bit of extra supplies. That's my only practical advice. Beyond get the shot, wear a mask, and distance. I just really think this thing is not over. And hey, if I'm wrong, then you don't have to, buy toilet paper for a month or something. All right, I'm going to leave it there. Thanks for listening. Thanks to the current patrons whose names are on the screen. If you'd like to get your name on the screen, head to patreon.com/socialism for all. You can sign up for as little as $2 a month. Donations are not your thing. Totally understandable. We're in another economic freefall. Liking, sharing, subscribing, and commenting is always helpful. Particularly, we're not on Facebook at all anymore. We are on Twitter now, though, as you can see in the graphic. If you can share into any left-wing Facebook groups, join and share into. There's sometimes thousands of people in those groups, and I always found that a good place to promote S4A stuff. Anyway, until the next video, I had more of those Social Democrat critique clips. I had to just do other stuff this weekend, so I kind of dropped it midstream, but I may resume those when I get some time later in the week. Have a good one.